Is it true that dermal fillers can mimic a dental infection?
Find out today on Medical History Mysteries.
Hey, everybody, welcome to another Medical History Mysteries. I'm Pam Maragliano. With me, as always, Tom Viola. Tom, oh my gosh, so patients can come in thinking they have a dental infection. We can look in their mouth and it can look like a dental infection, but it could actually be from a dermal filler. Like, what is that? What is that?
So this has, and I always thought it was just we had to worry about Botox, right? Like, Botox can cause problems, and everybody gets that. It's an understood risk. But we're talking now. We're not talking about lip filler. We're talking about dermal filler, like you want to fill in the hollows of your face. You want to like fill in the space under your eyes, or you want to puff out your cheekbones a little bit. So
I want
according
it.
to the NIH, right? These fillers can develop these dormant biofilms. And these biofilms now can be activated by dental procedures. And so now you end up with an abscess or cellulitis. And that it ends up looking and feeling exactly like an odontogenic infection. But it's not an infection at all. It's this localized inflammation. But because it involves a biofilm, you could say that it's infectious as well. And that was the first cause of concern for me because I'm thinking, wow, if this was me and I was a layperson and I felt what I felt was like an abscess in my gum, and using lay people's terminology, I'd come see my dental professional, my hygienist, and my dentist, and say, "What's going on? What's this thing?" And you, not knowing I've had fillers placed, wouldn't know either. And we'd go down this almost this rabbit hole of trying to figure out how did you get this infection when you really don't have an infection. And how did this inflammation occur? And then, is it periodontal disease? Is it not periodontal disease? And then the other thing was that the NIH also said that this can actually also affect the jawbone, that they've noticed that there's direct bone resorption uh, or localized bone resorption, let's say beneath the chin, following certain cosmetic procedures that involve hyaluronic acid, which is common in fillers. So again, now I'm your layperson patient. I don't know what's going on, but I look like I have abscesses and I look like I've had some resorbed jawbone. Holy moly, what's that all about? And where do I go with that diagnostic tree? So that's why I think it's important to bring attention of this to dental professionals because again, this could be a rabbit hole that ends up leading nowhere.
So, how are these infections treated? Are they treated with an I mean, in dental, obviously, we find the source of the infection and we treat that, and ultimately the infection will go away. Is this something that, say, an antibiotic or a medral dose pack or something like that is going to take care of it and then they just go on with their day? Or do they have to return to the person who injected them? And I know that in some cases, depending on the filler, there are reversal agents, but in essence, filler's kind of there to stay. Most fillers, you can't get all of it to come out.
No, it's not going anywhere. That's the thing. And you hit it right on the head. So first of all, you've got facial swelling, pain in your jaw, whatever, right? So you may not think to go to your medical professional. You come to see your dental professional and say, what's going on here? Now, if you're the average dental professional, you're going to do an X-ray, right? You're going to do some kind of radiography, and fillers can cause imaging artifacts. So now you don't even know what you're looking at. You think it's dental, it looks like it's dental, but it doesn't look like anything you've ever been shown before. And while I love the NIH because they bring this stuff to our attention, they don't really do much to tell us what to do because, it's dentistry. So they'll say things like, well, treatment may require an oral antibiotic, a steroid, or even hyaluronidase, the enzyme that breaks down hyaluronic acid to dissolve the filler. But that's outside the scope of dentistry. So now that really becomes something where we need to lean on our medical partners, our medical brothers and sisters out there, and say, look, this thing is the result of a filler. But by the time you got to that determination, how many dental professionals go down that road of thinking, oh, this could be done, a dermal filler related? I mean, if no one watched this episode, they may not even know it exists. Because again, pharmacology and dentistry change literally sometimes overnight. And if you don't stay frosty, you don't even know this is going on, you can go down that rabbit hole pretty quickly.
So we have to rely on our clinical decision making, our diagnostic skills, the diagnostic technology that we have, test the tooth, see if it's vital or not. And obviously, if it's something that we don't recognize or something that just looks outside the scope of what we're familiar with, but yeah, leading on our medical professionals for help. And hopefully the patient is forthcoming. Not all filler is obvious. Nowadays, they're doing more and more that's just subtle and you really can't even tell that it's there. And so obviously sometimes it's super obvious. And I think it would be something that would turn up pretty quickly, just even with your eyes. But I think, yeah, we're going to need to always be aware of this, that this could be something. But the bone loss, I don't think is readily talked about in dentistry. And I think when people are talking about fillers, they need to understand the risks there. And that's significant.
Now, just for a quick second, think how far this rabbit hole could go. You say, well, I don't know, I'm not equipped to deal with this. Let me refer you to a specialist, and they go to a specialist, and they don't know what it is. And we're going in the opposite direction where we should be, which is, okay, it's a filler. We should be attacking that and working with our medical partners, but we just think it's dental, and we're going, this could take weeks until somebody figures out what the heck caused it in the first place. And so that's why I think again, it's the three questions, right? What do you take? Why do you take it? And did you take it today? But maybe we need to add a fourth one on, which is, have you had anything done recently? Have you had any procedures done recently? Look, maybe people don't want to admit that they've had fillers. And I'll give you a good example. It's kind of not related, but in a different way. People get Brazilian butt lifts, okay? And do what you want. It's your body, right? But remember that they're taking fat from one part of your body and moving it to another part. Okay, so if it's not done correctly, that fat deposit could be injected inadvertently into a vein, which can lead back to the heart, which can lead to an embolism.
Oof.
And now, if I didn't know you had a BBL done and you show up in my ER, let's say, with an embolism, I'm going to think you have some type of coagulation disorder, which you don't, right? But that's the extreme. But if I'm a dental professional, my patient who's had that done may say, I've had this tingling in my hands and my feet, and I'm out of breath all the time. And heck, if we just knew to ask that question, we could refer that patient to get urgent medical care and maybe avert a pulmonary embolism. But if you don't know that, if you don't think of cosmetic procedures ending up causing, in this case, both dental and medical emergencies, or at least dental and medical problems, what if you don't think that way, then you just overlook it. And that's why I think we do such a good job in this our series. We bring these things to the attention of dental professionals, so it gives them another avenue to pursue mentally. Like, oh yeah, that was that thing that idiot Viola told me about that causes, and that I'm happy. You know what? That makes me happy that I know that I've broadened the scope a little bit for them. I mean, you and I talk about this stuff because you're the professional, aren't you? You're the one that's in the clinic. You're the one that's sorry, you're the one that's actually practicing clinically. And I'm just an academic at the end of the day. So I think that's why when we bounce ideas off each other, it's good because people get to see both sides.
Absolutely. Well, it sounds to me like this is an excellent addition to the medical history. And so asking, have they had cosmetic procedures, surgeries, filler, Botox? I mean, you think about surgeries, you might not get that answer because it's not like heart surgery or some other surgery.
Right.
And also, if you prescribe an antibiotic and it goes away temporarily, yeah, you solved that problem in that moment. But again, we didn't reach the underlying cause. So I think asking that question is vital for getting to the bottom of what's going on. And thank you for bringing that up because once again, I have never heard about bone resorption secondary to dermal fillers. And thankfully, we're going to knock on some wood here. I haven't seen any infections that mimic dental infections that are caused from a dermal filler. So who knows what we'll see next week when we go to work. But I think it's certainly something that I will now be aware of. So thank you for that.
And just one more thing, remember that this is a bit of a gray area because not everybody who does dermal fillers is a medical doctor. or necessarily a dermatologist. It depends on the local laws in your state as to who can do dermal fillers and who can't. So again, if you say, have you had a medical procedure done? No, it wasn't a doctor. It was a cosmetic procedure. And so again, it's the terminology. So yeah,
Yeah.
good
I
deal.
think great practice would be to add it to the medical history. Just kind of get it out there and see if we can get any more information. So awesome. Well, thank you for that. And everybody, thank you for joining us this week on Medical History Mysteries. And we will see you all next week.
Everybody.